Yet recent trials, larger and more rigorous, have not produced the hoped-for results. One study with 5,108 participants published this month in JAMA Cardiology found that vitamin D did not prevent heart attacks.
I love this reference. One study with all these people, it didn't prevent heart attacks. But the study was very poorly designed. If you look at it and think about how vitamin D works, the study was not physiological dosing of vitamin D. So when I recommend vitamin D to a patient, it's usually 200,000 IU a day that I will recommend people take. Not 2,000 IU a day, not 200,000 you would die. 2,000 IU a day with food and every day. So you get like a slow dosing all the time, like if you worked outside, like we used to do, hunting and gathering, farming. And if you do those things, you don't need to take vitamin D. But the way this study was designed, people came in once and got 200,000, so 100 times the dose I would give in a day as a shot. And then every month after that, they got 100,000 a month. So all your vitamin D at once, now none. And that's just not how the body utilizes things. It is a fat-soluble vitamin. It is stored up in fat. And so many people will dose it intermittently like that. But the body has evolutionarily, we got our vitamin D differently. So I like to try and mimic what the body is, quote, used to. So this was a 3-year trial. So you got people that were at risk of heart disease and gave them high doses of vitamin D every month. And after 3 years, they didn't have less heart disease. Well, vitamin D doesn't work by preventing a heart attack. It prevents the conditions that lead to heart attack. So once you've already got those conditions, vitamin D isn't going to prevent anything. But if you're a healthy 25, 30-year-old without those disease conditions and you start taking vitamin D at moderate levels, would that prevent your first heart attack? We don't know. But there is evidence to think that it might, as you look at population-based studies, as you look at epidemiologic studies. But when you design a study like this, it has nothing to do with physiology, and say in 3 years I didn't take these people at risk and reduce their risk, that's just not saying that vitamin D doesn't reduce risk. It's saying that vitamin D won't prevent heart attacks in people who are already at risk of them. Dumb study, bad design.
Does the article explain how they came up with the 200,000? How did they come up with that dosing?
Oh, no, That's just what they did. It's the design of the study. They might also have an agenda.
Another study published at the end of March, including 2,303 healthy postmenopausal women randomly assigned to take vitamin D and calcium supplements or a placebo. The supplements did not protect the women against cancer, the researchers concluded.
All right. So they took vitamin D and calcium supplements. And as I mentioned previously, calcium at high doses is associated with increased risk of breast cancer. So maybe not a great study designed to answer this particular question. Does vitamin D prevent breast cancer? 1. 2, how does vitamin D, theoretically, if it were to prevent cancer, how is it doing that? Well, vitamin D is an immune system modulator. So as the immune system is learning to tolerate or not tolerate something, vitamin D is involved in that. It helps something called T regulator cells differentiate. So the regulator cells kind of calm down the immune system over here, stimulate it over here, help with the balance. Say, okay, you did that job now, shh, right? But they're also involved in educating the type of cell that goes in and cleans up the mess after inflammation has happened. It's called a macrophage. So vitamin D helps your immune system regulate and balance, and it helps clean up the mess after the immune system has done something. So cancer doesn't form today, and now you're dying of cancer. Cancer gradually forms over a long period of time and multiple changes in a cell. And so there's many opportunities for the immune system to go, hey, that cell no longer looks like me. I should probably kill that. I should probably get rid of it. Hey, T regulatory cells, come over here and help me do this. Macrophages, come over here and eat this. It just shouldn't be there. So vitamin D is involved at that level of the immune system. So if you take postmenopausal women who probably already have pre-cancerous changes in their breast cells that are developing, you give them vitamin D and calcium, you don't prevent cancer over a 3-year period, I believe. So if vitamin D is working on the long haul, a 3-year test to see will it prevent anything in these women who already have maybe things developing along probably isn't a good design either. So I was not convinced that that was a reason to stop my postmenopausal women from taking vitamin D supplements.
Other more ambitious studies are underway, including a 5-year randomized study of almost 26,000 healthy men and women, directed by Dr. Mason and
Manson, the woman who did the IOM
yes,
report, yeah.
Dr. Manson and Julie Buring, who hope to answer once and for all whether taking vitamin D can prevent cancer, heart disease, and strokes.
5 years is not going to answer that once and for all. Again, I believe by modulating the immune system, modulating inflammation, that is how vitamin D is preventing strokes, heart disease, cancer, not by going in there and going, oh, let's clear up that coronary plaque. So if you're just studying for 5 years, you are not going to catch this. What you have to do is a long population study, which no one will ever pay for. So the best we're probably ever going to have is anecdotal evidence. And again, those studies tend to indicate a benefit of people with higher vitamin D levels and lower risks of these diseases.
The frenzy for vitamin D
Frenzy. That's all I have to say. Go ahead.
began not in natural food stores but in medical journals. Beginning around 2000, a series of research papers linked vitamin D levels that are lower but considered normal to multiple sclerosis and mental illness, then to cancer risk and bone health.
Sorry, I should stop you there. Those studies have not been denied. There's been no evidence to say they're wrong. Those were the studies. They came out, got people's attention.
Blood testing for the vitamin took off. Quote, patients began asking for it, said Dr. Fairfield, the researcher in Maine. A lot of people thought that if they were fatigued or sad or did not feel well, they might be vitamin D deficient, unquote.
A lot of people thought. Patients began asking for it. How many times have you been watching TV and an ad comes on? Ask your doctor if this drug is right for you, right? A lot of people get a lot of ideas planted into their heads from a lot of sources. That does not mean that the idea they have is wrong or founded on bad science. Just because people are demanding something doesn't mean they're wrong. Maybe they're over demanding it. That's possible. But it's the job of your trained healthcare professional to help you navigate these waters. So competent healthcare professionals can do just that. So you get exposed to something on the internet, you get an idea about what's causing your fatigue or your malaise. It's my job, Susan's job, to help you figure out, is that good insight? Or, wow, I'm glad you brought the fact that you have malaise to me. Here are some other things we might think about. Interesting that you ran into that on the internet. Let's think about if that applies to you and move out from there. So just because people are getting this corrupt idea that they need vitamin D, when they do or maybe don't, it doesn't mean that it's bad that there's been consciousness about this issue.
In 2007, Dr. Hollick published a paper in the New England Journal of Medicine asserting that vitamin D levels now considered normal, 21 to 29 nanograms per milliliter of blood, were linked to an increased risk of cancer, autoimmune disease, diabetes, schizophrenia, depression, poor lung capacity, and wheezing.
I actually want to stop you again. I'm sorry I didn't do that anything there, but as I read this, Dr. Hollick published a paper in where? The New England Journal of Medicine. Peer-reviewed, really rigorous, and he had data, studies to back up every one of these claims or he couldn't have gotten the paper accepted. The paper has not been debunked. The paper was published in 2007. That got doctors' attention and we started testing people. Was that wrong? Should we not have changed our practice based on a peer-reviewed, accepted, not debunked study?
He also published books promoting the idea that vitamin D levels in that range were insufficient to promote good health. In 2011, a committee of the Endocrine Society, headed by Dr. Hollick, came out with a recommendation that vitamin D levels be at least 30 nanograms per milliliter, which meant that most people were vitamin D deficient. The group recommended the taking of supplements, but not widespread testing, on the grounds that this would not be cost effective. The new guideline had an immediate effect. Commercial labs began describing levels of 20 to 30 nanograms per milliliter as insufficient. Many continue to do so today. Quote, there was a vitamin D bandwagon, said Dr. Sandeep Khosla.
No, Khosla.
An osteoporosis expert at the Mayo Clinic. Vitamin D test, quote, became incorporated into the general evaluation of patients, he added. Ravinder J. Singh, who runs the testing lab at the Mayo Clinic, was taken aback by the sudden deluge. Demand for vitamin D testing went through the sky, he said. It was almost as though there was nothing else serious in clinical practice, unquote.
Stop. Because I'm testing your vitamin D, of course, I'm ignoring every other factor that might be leading to your ill health. I mean, what is this? This is absurd. Yes, we continue to check cholesterol and blood sugar and a lot of other things that were impacting health, thyroid levels, but we also started checking vitamin D and addressing it if it was low. And my low did get defined by Dr. Hollett's paper, and I have no reason to change it from that. 20 to 30, that's low. That is not high enough to turn off bone metabolism to release calcium into your bloodstream from your bones, which I don't want you to do. I want you to keep your bones.
Dr. Fairfield, like many other general practitioners, began testing patients, trying to make sure they raised their vitamin D levels above 29, and became concerned that she and other doctors had been too cavalier about the vitamin. We were worried that there was a lot we were missing, she said. But when the Institute of Medicine report proved critical of the vitamin D craze, she started telling healthy patients there was no reason for them to be tested. Many did not want to hear that advice. Quote, people were used to vitamin D monitoring, like with cholesterol, Dr. Fairfield said. They wanted to know what their number is, unquote. Although Dr. Fairfield stopped routine vitamin D testing, many others have not. Becky Rosen, 64, a nurse who is director of clinical services at a home health agency in Brunswick, Maine, had a physical exam 4 years ago and was told she needed a vitamin D test. She declined. Her next physical exam was in February with a different doctor. Once again, the doctor wanted to test her vitamin D level. I said, I don't think I need it, Ms. Rosen said. The doctor persisted, explaining that Maine is so far north that people may not be exposed to much sunlight. Once again, Ms. Rosen politely but firmly declined. But she is a special patient. Her husband, Dr. Rosen, helped write the Institute of Medicine report that was critical of vitamin D supplements. Quote, I can see other people getting persuaded, Ms. Rosen said.
Persuaded to do what? Persuaded to check a commonly deficient nutrient, the replacing of which does not cause significant problems as long as it's done carefully, that may, we're not sure yet, decrease the risk of certain cancers, decrease the risk of heart disease. Certainly it decreases the risk of osteoporosis. It decreases the chances that you will fall if you have osteoporosis and that you will break your bone if you do fall. It has a lot of potential benefits. I've never had a patient have a problem with vitamin D. So what is the resistance? I'm not sure, but I will say that in my experience, there's a general resistance in the more established medical community against nutritional interventions doing any benefit. I was recently reading an article on the use of vitamin C in the ICU with critically ill patients. It is not standard of care. It has not been established, introduced everywhere. And yet, every study shows really clear evidence that it decreases your risk of dying in the ICU. So why wouldn't you give someone vitamin C? I have no reason. I don't know. But it's that kind of thing that you see over and over and over again, and it leads to articles like this that make patients confused. And it's fine with me that you guys are reading these articles. You're smart. You're incredibly gifted consumers of health information. And I want to say, like, at least 10 of y'all forwarded this article to me, as well as my husband, which is why I thought, let's just pick this apart. And I was eager to have you see inside my head and how I process and think through both the agenda of the article writer and the agenda of the science community in general, medical community in general, when they poo-poo and raise fear about things like low doses of vitamin D, totally harmless, but yet are extremely cavalier prescribing very frightening medications to my patients all the time, and not even recommending dietary and lifestyle changes. So I'm disgusted. But I'm glad that I'm your doctor, and I'm glad that Susan and I are able to take care of you. And you can trust that we are trying to sort through all the changing information as carefully and thoroughly as we can, and we never hesitate to change our practices when we're convinced that they're wrong. Thanks. Thank you, Jed.